This is Laurel Mildred from the California Collaborative for Long-Term Services and Supports. Joining me today is Dr. Peter Currie, Clinical Director of Behavioral Health for Inland Empire Health Plan. Peter is here to describe integrated behavioral health services and how they contribute to a high-performing system of long-term services and supports.
Thank you, Laurel. Behavioral health services include both mental health and addiction treatment. Up until now, behavioral health has largely been separate, disconnected, and uncoordinated from the rest of the healthcare system. These services are also underfunded. Of an estimated 13 million American adults who have a serious mental illness in any given year, only about 29% of these receive any treatment at all. And of those, about 15% receive minimally adequate care. Untreated behavioral health issues result in poor outcomes for people, as well as higher costs for taxpayers. By leaving behavioral health conditions untreated, other health care costs go up. People with serious mental illness in the United States have a life expectancy that is 25 years less than other Americans. And in some places, that number is even higher. We found in Riverside County, where I live, that life expectancy of people with serious mental illness is 36 years less than the average. Untreated behavioral health problems and uncoordinated care are expensive. Medicare, for example, spends 5 times more on beneficiaries age 65 and older who have both a severe mental illness and substance abuse disorder than it does on similar beneficiaries without these diagnoses. Full access to integrated behavioral health services is essential to better serve the needs of the people, as well as to bend the healthcare cost curve and save money for taxpayers. Right now, behavioral health is rapidly evolving. The Affordable Care Act, parity between behavioral health and physical health services, as well as integrated models like CalMedi Connect, dual demonstration project, are all promising significant improvements in behavioral health services. These changes will bring about expanded access, as well as stimulate integrated approaches and better quality and outcomes for people who need treatment in California. In some cases, providing access to services for the first time for individuals with Medi-Cal who did not have access to mental health services in the past. There are a number of strategies for integrating behavioral health into health systems, bringing behavioral health in-house within a health plan rather than delegating it to a separate entity, leveraging web-based technologies to improve coordination of care between primary care providers and behavioral health providers, as well as building an open network of mental health and addiction treatment providers who can deliver timely access. It's important to demonstrate the value of these services by measuring outcomes and results, which we have focused on here at Inland Empire Health Plan. At Inland Empire Health Plan, we actually removed all gatekeeping from accessing behavioral health services so that any member who requests behavioral health services could get a rapid referral to a behavioral health provider without requiring a referral from their primary care physician or any other severity criteria that might be a barrier to accessing care. In the first year, we doubled utilization of our outpatient services for the members we served. And this expanded access cut our expensive inpatient psychiatric costs in half. Simply having prompt access to quality outpatient services reduced the number of admissions to the hospital, and therefore these expanded outpatient services more than paid for themselves in the reduction in other costs like psychiatric hospitalizations. We infused behavioral health expertise at every level of the health plan, significantly improving the coordination of physical and behavioral health care. And by 2012, we met 100% of the National Committee for Quality Assurance's requirements for behavioral health. Fully integrating care allowed us to provide better services to many more people without additional cost. Integration of behavioral health with physical health can be achieved and is essential to building a person-centered system of long-term services and supports.
Thank you for sharing this information, Peter. If you'd like to learn more about other issues that impact long-term services and supports, if you'd like to hear more podcasts of this nature, or if you have any comments or questions, please visit www.ccltss.org or call 916-966-6643.